And yes, I'm back again. I had the good fortune of working with another company very closely and advising SenseLy. Imagine game-changing innovation, avatars, and artificial intelligence all being used to change the way patients interact with the healthcare system. Well, when I heard that pitch, I was immediately interested in learning more about what Adam Odessky and his team at SenseLy were doing. So in just a few moments, Adam will introduce you to Molly. Molly's currently being used by U.S. clients in California in the Kaiser system, but she's one of several avatars working with patients across the globe. You won't meet Olivia, but know that Olivia, who speaks with a British accent, interacts with patients who are taken care of through the National Health Services in the UK. Patients have been incredibly responsive to this platform. They're satisfied with their interactions, and what happens is that the outcomes, the health outcomes, and again, Adam will share those with you in just a moment, but they are stellar. So in the past several months, I've sat with Adam as he has presented the SenseLy platform to local health executives. And the conversations would initially begin with, well, we've got processes and we've got technology. We're doing all sorts of things to take care of our chronically ill patients. But as Adam would carry on with his presentation, we would hear, wow, this is amazing. We've never seen anything like it. So it's a really interesting, powerful platform. And over this time that I've had the opportunity to advise Adam, I've been amazingly impressed by the depth of his vision and the technical capabilities of his engineering team. They've created a platform that rapidly demonstrates broad-scale value today, but also remarkable possibilities for the future. So it's my pleasure now to introduce Adam Odessky, who is the CEO and founder of SenseLy.
That was amazing. Thank you, Aisha. That was great. So we're SenseLy. My name's Adam Odessky, and we're a virtual nurse platform that helps physicians better manage and communicate with their patients. So what is the problem that we're trying to solve? So we all know about the disproportional share of costs that chronic diseases impose on our healthcare system. In fact, 5% of Americans account for over 50% of all the system's healthcare costs, and doctors and budgets are struggling to cope. The problem has really reached a crisis proportion. And we think that technology can really help, but not just any technology. We need deep patient engagement. We need actionable data. We need to create value for all the stakeholders in the ecosystem, including patients, providers, as well as the payers. And that's essentially why we built Molly. So Molly's unique user interface was purpose-built for deep patient engagement. It's mobile first. It combines a virtual nurse avatar with speech recognition, artificial intelligence and machine learning, and medical device integration. We're making patient interaction simple, intuitive, and also motivational. And we've proven it to be highly effective because of the power of the virtual human connection. Let me show you an example of how SenseLy is being used in a heart failure setting by patients today.
Our app can be a part of their lives every day. So our avatar Molly, she can check in with the patient every single morning, more than once a day if that's needed. She can ask the patients how they're doing. She can collect really important information such as their weight or their blood pressure, glucose levels, ask them relevant questions to whatever condition they might have. And all this information can be funneled back to the clinician seamlessly so the clinician can just be alerted to which patients are actually possibly having an issue that day.
Your weight is 190.9 pounds. You did not gain any weight. That's good.
But that's not all the product does. Inside SenseLy, we built an intelligence workflow engine that puts clinicians and care teams in control. Using SenseLy, they can easily assign these sort of Molly assessments to their patients. Molly does all the monitoring and informs the clinicians if patients experience any unusual risks, such as weight spikes or high blood pressure, etc. Clinicians can then immediately look at the record and perform an intervention, a medication adjustment, having the patient come into the office, a telemedicine visit. All that is done by the SenseLy platform. So in a recent pilot that we did with Kaiser Permanente in heart failure, we discovered that we slashed operational costs for the care team by over 3 times without impacting patient satisfaction at all. So patients are just as happy using Molly as they are actually talking to a nurse on the phone. The other thing is that we increased capacity of the number of patients that nurses can manage by 2.5 times. And the best part of all, in our programs today, we have not had a single readmission within 30 days on the same exact cohorts as the traditional heart failure clinics. So we've been a company for just over 2.5 years, and we've been fortunate enough to work with some of the largest names in the healthcare business, including the National Health Service of the UK, MetLife, UCSF, and Kaiser Permanente. All of our contracts and deals right now are paid, and we're expanding it more. And we've been also, in the last 6 months, creating a really engaging relationship with the Texas Medical Center, particularly the institutions outlined here. We've done it both on a partnership level as well as on a research level, and we plan to deploy to our first patients in the next few months. So we have to hope to continue working with the Texas Medical Center and create something great for patients and have them live happier, healthier lives. Thank you very much for SenseLy.